This next exercise is what we call a hip abduction exercise, similar to the one that we did in a supine or lying on your back position, but this one's a little bit more advanced because we're in a standing position. You're having to put weight bearing on the leg, and this is really, really good for multiple reasons. Number one, because your knee is still, you're about 2 to 4 weeks status post some type of knee injury or knee surgery, but you want to start putting weight into that leg to re-stimulate bone healing, etc., and muscle building. But what you're going to do in this hip abduction is and you can do both legs. Okay, so let's assume that your right leg is the operated leg, and that's the one that we're going to emphasize first. And like Wyatt is demonstrating, he's taking the leg away from the middle of the body, which is what we call abduction or abduction. He's taking it out. He's keeping his feet nice and straight, not rolling that leg out like we discussed earlier in a supine position, because then you're working your hip flexors, not your hip abductors, your gluteus medius and minimus. And what's also good about this exercise is the leg that's staying in contact with the ground is actually getting work too. So it's working on balance, it's working on proprioception, and it's working on strengthening. So you're working many different body parts at once. So this is a great exercise. Don't have to go out too far. Normal abduction for the hip is about 45 degrees. So you don't want to be leaning and causing issues with the back. You just want to be going out and back nice and slow. Remember that eccentric contraction, nice slow lowering position. Again, you're going to repeat around 10 repetitions. You're going to rest a minute and repeat 2 to 3 times. Again, once you get to 10 repetitions, you can build up to 20. Once you get to 20 and you can do those comfortably, again, you can add an ankle weight, a 1 pound, 2 pound, 3 pound ankle weight until you build up. Hip abduction, strengthening the knee, strengthening both knees. And then again, what you can do is switch to the opposite leg. So if this is your operated leg, you also want to be doing the opposite leg so that you're getting some weight bearing through this leg, and it really helps work again on that balance and proprioception on the operated leg. Hip abduction.